Well, it is important, though, when we talk about single payer, particularly with union members, and we ran into this dealing with the Kucinich Amendment, right? Because one of the concerns is these Taft-Hartley trusts that a lot of the unions have provide benefit plans. Those would be either eliminated or sharply reduced under single payer. And that's a real issue, because they provide an organizing vehicle for many unions, they provide important benefits, they sacrifice wage increases to get those benefits. And so there is a role for supplemental benefits under single payer. It's like the Canadian system, right? And so that's really what we're talking about here, is that they would be able to offer those supplemental or special needs benefits. The other elements here I think are pretty straightforward. There obviously is cherry picking, and under the Senate proposal it gets pretty bad. The risk pool is not shared by everyone. Costs are shifted to the sicker of those privately insured, even under the public option, and the public plan really is designed to pick up the sickest. The employment dependency of the current system is, as Terry very well said, hugely discriminatory against part-time workers, and particularly women. And the fact that there's much talk about the elimination of the pre-existing discrimination, pre-existing condition discrimination, I am not convinced. I really think that the insurance industries are very capable of gaming this system, right? And I don't think there's anyone, you don't have to be too cynical to see that. Plan will help negotiate lower healthcare delivery costs and lower drug costs. This is where we may disagree with the league on this. And we do think that there is the potential, under the House bill, there still is the provision for them to negotiate prescription drug prices with pharmaceutical companies, which was cut out with the Senate, under the Senate plan. And let's remember the three deals that the administration cut, right? With pharma, $80 billion, right, in savings. Do you know what those savings go to? The savings go to, are applied to the purchase of brand name drugs when seniors are in the donut hole. Now the donut hole is that part of the prescription drug benefit under Medicare where the individual is liable for all the out-of-pocket costs, right? After you spend about $2,600 for drugs, then you enter a period where you have to pay for the whole cost, and then it picks up again after your spending reaches about $5,000, roughly. That period is where that $80 billion is applied. Because what do seniors do when they reach the donut hole? Buy generics, if they can, right? So what do the pharmaceutical companies want? Buy their brand name drugs. So what do they put this $80 billion toward? Buying the brand name drugs. That's the deal they got with pharma. The geniuses in the White House negotiated that. All right. Then the 150, I guess that's why we don't get invited, right? $155 billion from the Hospital Association. One study says, guess how much the hospitals are going to make when everyone has private insurance? About $170 billion. Oh, so they're giving us 155 and they're making 170. Let me do the math. I'm trying to think. Oh, that's a $15 billion net for them. Okay, so that's two deals that benefit the industry. Then the deal with AHIP, I'm not exactly sure what, what the deal with AHIP is. AHIP is now opposed to the House bill, right? But I think you'd have to say that the deal that AHIP got is probably the whole thing, right? The whole enchilada, right? Isn't that really it? Because the individual mandate is what they care about. And what AHIP is associated, the American Health Insurance Plans, the trade association, what they're primarily concerned about is preserving a strong individual mandate, naturally, and that's what they're fighting, is any erosion. Like on the Senate actually kind of doesn't necessarily want to tax people. Because remember, you're taxed under the House bill for the mandate if you don't purchase the private insurance, 2.5% of income. And going up from there. Going up from there. So you could pay as much, I think it's $8,000 or $9,000 as a penalty if you don't buy the private insurance. But it's a minimum of 2.5% of income. So that is a very strong individual mandate. In the House bill, right? The more progressive bill. The Senate, actually, the penalties are much, much less. So those deals clearly are a driving force in how the bill is going to be shaped between the Senate and the House. Yeah, no, just a second. I'm going to wrap it up. So where does that leave us? I think we can say pretty clearly that there are going to be people who have insurance under this proposal, and the 45,000 people who die each year because they don't have insurance, that number will probably go down. Lives will be saved by this bill. Right. Not I think, by any means as many as would be saved by single payer, but some lives will be saved by this bill. Medical bankruptcies will not really stop, not at those levels of out-of-pocket costs, right? Costs will not likely decrease very much. Insurance industry profits will increase. They have salvaged their business model. That's another way of looking at this bill. They have salvaged a failing business model for the private insurance industry by requiring everyone to buy their product and then enabling them to design their customers for maximum profitability. And then there's new monies for public health, community clinics, and truly the poor, through Medicaid, will have an expanded set of, there'll be more poor people who can get health care, basically. Let's put it that way. So where does that leave us? That leaves us essentially where we were a couple of years ago, with a fight that we're going to have to wage at the grassroots, not be, I don't think, scared to take this reform proposal on. So what we want to do in California is we want to elect a Democratic governor who will sign a single-payer bill that we've gotten to the legislature twice. It'll have to be modified in the context of this healthcare reform fight, and then prepare for a ballot fight. Either it'll be put on the ballot by us, or it'll be put on the ballot by the restaurant association or some, the insurance industry, whoever it is. And maybe that will be as soon as 2012.